Hey guys, so this is me Yash Chaudhary here, and today I don't have a travel blog for you guys, and this is only the second video on my blog, and I want to introduce myself and the topic that I've chosen today, looking at the circumstances across the globe and in our country. I'm going to talk about coronavirus. You must be hearing about it all around you, right? And so first I tell you something about myself and why I'm doing this video in the first place. I'm a data science consultant, and I don't know how many of you know what that profession is, but as part of my job, what I do is I analyze large quantities of data and help make decisions based on that data, right? And I help companies and the clients that we have to create their strategy around data. And because of a strong affinity towards data and reading data, I have been spending an enormous amount of time for the past 8-10 days especially looking at the data for coronavirus and COVID-19. Major reason why I started looking at that data was the stock markets were crashing, right? And I was losing huge amount of money every day. And when I started looking at the data, I realized that there's something which people do not understand about how the progression of this virus has been so far. And especially in India, I've seen people still not understanding the gravity of situation. Not just people in rural areas, but even some of the friends whom I know who are very much aware and educated and are themselves from somewhere connected to the healthcare fraternity. Even they have not taken the situation as seriously as they should have. So what I'm going to do today is I'm going to give you guys a timeline of what has happened with coronavirus, where the first signs came till today. What were the important milestones that the world has crossed on its way to this day? And then I'm going to bring your attention to understand why coronavirus is not something to be taken lightly. And then we are going to get into Indian situation, about where we are placed among the other countries of the world. And I'm also going to give you an idea about why are we doing whatever we are doing in this country, right? So we had PM Modi come over and speak about the actions that we should be taking 2 days back. And I know a lot of people are taking it lightly still. I hope that by the end of this video, all that cloudiness or fogginess around why you should not be doing what you're asked to do, it probably will get clear. So, and I'm just doing this video in super urgency, so pardon me for not being able to edit it too much, or it's a single short video. Whatever comes out comes out. Okay, so what has happened? Let's begin with the timeline. And there are lots of facts here, so just bear with me for some time, but I assure you you'll get a very good understanding of what has happened at the end of it. 31st December 2019, China confirms that they were treating a lot of pneumonia cases from unknown reasons. Jan 11th, China reported its first death. Jan 20th, other countries in the world including US and Japan start reporting the first cases. Jan 23rd, Wuhan was cut off from rest of the China and rest of the world. Jan 30th, WHO declares a global health emergency and India reports its first case. Jan 31st, US banned travel of people who had been to China in past 14 days. February 2nd, first coronavirus death outside China. Feb 11th, the disease got a name, COVID-19 from WHO. Feb 14th, France reported its first coronavirus death in Europe. Feb 21st, the virus appears in Iran from an unknown source. And this is something really, really scary because in Iran we still don't know what was the source of the virus. Feb 23rd, Italy sees a surge and orders lockdown of various towns. Feb 26th, Latin America reports its first case. Feb 28th, Europe had cases in 14 countries, all of which had traces coming from Italy. And coronavirus enters the sub-Saharan Africa through Nigeria on the same day. Feb 29th, the US sees first death and announces travel restriction. March 13th, Trump declares a nationwide emergency in US. March 17th, France imposes a nationwide lockdown. March 19th, and this is a good news among all the bad ones, Wuhan and China, in fact, reports first day when they found 0 new cases in the country. And unfortunately, that is also the day where Italy surpassed China with most number of deaths because of coronavirus. March 19th, PM Modi addresses India and asks you to follow the Janata curfew and gives other guidelines on how to behave in this times, right? And March 21st, Italy's death numbers are breaking the highs every day now for last 3 days. And on the good part, China reports 3rd straight days where they found 0 new cases of coronavirus. Do you understand what has been happening here, right? The disease originated from China. They imposed strong social distancing and suppressing modes to curb the disease. Italy was a place where disease was carried to, right? It didn't even originate there. But because of stupidities and foolishness that have happened because of people in the initial few days, Italy has reached this stage where most number of people have died in their country, despite the fact that Italy is one of the richest nations in the world and has the most advanced healthcare systems. Why I'm bringing this point is to draw parallels between Italy and China. China having been affected so intensely has been able to curb because of strong social distancing and isolation measures. Italy, on the other hand, did not have to go down into this spiral, but it has happened to them because of carelessness in the first few weeks after the virus came into the country. And now, in last 10 days, what has happened, I want to bring your attention to that. Within last 8 to 10 days, a lot of countries have gone from saying that coronavirus is not a big deal to declaring a state of national emergency. And it is very important to look at this fact to understand how rapidly this thing grows, right? I've seen a lot of people arguing, and I've seen those posts on social media as well, that there's so many people dying of road accidents every year, and then there's such a high fatality rate because of flu and influenza. And people are saying, why are we worrying so much about coronavirus, right? And let me get this thing very straight to you. The 2 reasons why corona is much more deadlier and a lot more scarier for us. There are 2 reasons to that. First, road accidents. They're not contagious, right? It doesn't happen that, okay, if I have a road accident, someone else in my family will also have a road accident. They're not contagious. They don't spread. Look at the speed at which this thing is spreading. Every person who has corona on an average, reported initially by China, on an average, he was spreading it to 4 people. Do you understand how crazy it can get? And looking at the timeline, you see how insane the situation has become. And also, no road accidents has overwhelmed a country like Italy and crushed their healthcare system. People in Italy have not died solely because of COVID-19. People have also died because the hospitals were running full at capacity and could not cater to other patients. So there's a lot of collateral damage of this disease. Second point, we don't know much about this virus so far. Are you aware that the virus has already mutated a couple of times? So I was just reading an article some time back which says that in China itself there were two strands of viruses, right? So there are two mutations of coronavirus in China itself, and then in other countries like US has a certain strand of it, a certain mutation of it, Europe has a certain mutation of it. Try to understand how hard it will become to come up with a vaccine or anything preventive or a medication to treat the disease when it's mutating it at this rate. And especially when we don't know if we're going to have enough time to create the vaccine to prevent the thing from spreading across the globe. So let's stop this stupidity of comparing it with road accidents and flus. Now, there are two options that we have, right? Either we fight it now, or it becomes an epidemic, the scale of which the world probably hasn't seen since Spanish flu, and I feel probably it can even become bigger than Spanish flu because of the sheer population in the world right now and how connected we've become, right? Couple more facts I'll bring in. Currently there are 4 countries which are worse in number than Italy before it ordered a lockdown. There are 16 countries which are worse than Hubei province, which is the region where Wuhan city is. There are 16 countries which have numbers higher than them when they ordered a lockdown. And surprising thing is, most of these countries, they are richest among the world. They have the strongest healthcare systems. So does it mean that the virus is biased towards richer countries? No. What it means is the richer countries are probably better able to trace the virus, track it, and test people. Now, poorer countries, imagine whatever the numbers we are seeing on media, how likely is it that those numbers are understated? How likely is it that we've not tested enough people? And given this fact, there's all of these buzz that you're seeing around about social distancing, about being extremely careful about your hygiene and not stepping out of your houses and things of that sort. Now, already in India, we have lockdowns in various parts of countries. There is a Janata curfew tomorrow, which is primarily the reason why I'm putting up this video, however it comes today. Let's try to understand that this social distancing is only required for a couple of weeks, right? In a couple of weeks, you hammer down the virus growth significantly. And the most important thing, like why would you want to stay in your home? And many people must be thinking that how long can I stay in my home? The virus is going to grow anyway. No, you're mistaken badly. What we want to do, the whole objective of staying in our houses, not moving around too much, not going out in public places, the whole objective is to buy ourselves and our government and our health system more time. More time so that we can be prepared to test more people, we can be prepared to treat more people, we can be prepared to handle the comorbidities and the collateral damage that this disease can bring. India has only 70,000 ICU critical care capability, and I have posted a link of an article which has inspired me to put up this video. Go check that out. Even in countries like US, with 1 lakh ICU units available, the projected fatality is so high. If strong social distancing is not observed, you're going to be blown out of your mind looking at that number. And then translate that to India. I understand many people are saying that we are a hot and humid country and it is going to help. Definitely it's going to help. But then we have the outbursts happening in Malaysia, we have the outburst in Singapore, we have the outburst in Brazil, we have the outburst in Indonesia. All of these countries have climate similar to ours. So we can't just rely on hot and humid. So coming back, we need to buy more time in hopes that a vaccine will come sooner, to understand the disease better, find better treatment options, to get the messaging clear to people even who are at the lower end of spectrum in terms of awareness at this point, or who are not sincere enough still about how they should be conducting themselves in the next few months. And to prevent people who are unaware from getting affected, because if they get affected, they are going to create a viral chain out there, right? And read in detail about what happened in Italy to understand what I'm talking about, how that viral chain can really screw us over. And of course, we need to buy more time also to prevent the economic activity from crashing down from sudden outbreak. Now, a lot of people are thinking that my business is going to suffer, my studies are suffering, or my daily routine is going to suffer. Guys, if you don't act now, if you don't do what you're asked to do right now, you may suffer for as long as a couple of years. If this thing outbreaks in India, if this thing spreads in India, there's no way that we're going to be able to contain it. No way. We don't have the facilities. We can't even test all our people if we start seeing sudden growth in the number of suspicious cases. So try to understand, try to act responsibly at this point. And an important thing to understand here is also that our social setup, our lifestyle, is a very, very strong and subtle addiction that we all have. And we have two types of people currently, right? There are people who think that it's not a big deal and then everyone is overreacting. I hope that the entire timeline that I have presented and all that I have told you so far might have convinced you that it is indeed a big deal and it can really, really take us deep into trouble if we don't act. And then there are second breed of people who probably understood it intellectually, but it's our lifestyle, right? After all, and the addiction or the way we live, it's such a subtle pattern that unknowingly, even though they know that they have to act in a certain manner, unknowingly they are acting in a way which is putting themselves and other people at risk. The urges we have to go to the malls and to buy smallest of the items from our wish list, getting food delivered, going to the bars and pubs to get our clothes out for laundry. I would just say a single thing, that every time you interact with a new person face to face, every time you go out of your house, ask yourself this question, that is it really, really, really critical for me to do this? Because those patterns are strong, right? I was just roaming around in Goa 6 days back, and I think the next day after that, I read Italy's situation because someone sent it to me, and after that, in last 5 days, I have not gone outside the apartment complex where I'm staying right now in Goa. I'm just homebound. And that's the thing. I feel that if we look at the details, the numbers, if we look at the stories that have happened with people, it's so sad and it's so threatening also at times that we have to choose to act. And I think there's no amount of convincing can do any good unless we have seen the facts. And I really believe that once you've seen the facts, once you've looked at the pace at which this thing grows, automatically you understand that the habits, the patterns probably they can take a back seat for now. Those birthday parties, those gatherings, social, religious, anything. I think it's time right now to just pause all of that. And I have no intention to create any kind of panic here, or I don't want to sound depressing either, but I just want to ensure that we really understand what the underlying numbers are. And I know many people might have looked at those numbers themselves, but I also know that not many people have seen the numbers in first hand, right? And that is the reason why I decided to come out here and create this video. So, in the end, I would just request you guys to understand that this is not anything that you have witnessed in your lifetimes. There are many people who are calling it even bigger than the world wars in European countries and the US. We've already seen the Chinese story, the Italian story, the story of Iran, what is happening right now with Spain. Check what is happening with UK and US, and you'll understand that these advanced countries, the amount of resources they have relative to India and the awareness that these guys have compared to us, in spite of that, what they're going through, it's really something to take notice of and learn from. So I would say we can probably do a DIY for next 2-3 weeks, right? Wash your own clothes, cook your own food, maids, servants, delivery boys, couriers, just stop everything as much as you can, of course. And maybe this is the time to reflect upon those ideas that you've never got time for, to have those conversations with people in your family that you never got time for. Maybe write that blog, create that video, read that book, watch those top selected movies you wanted to, do all of that. And really avoid going out. Take this thing very seriously. And I'm going to put some resources in the links. Just read through them and you'll get a very strong handle on why you need to take this thing seriously. But please don't panic. Don't rush to the hospitals in panic to get tested, because hospitals are themselves a high risk area for you to get infected, right? So just really ask yourself, whatever you're doing, is it making sense? And is it putting you at risk of getting infected? And let's hope that this thing gets over real soon and we all fight through it together. Bye-bye. Take care, guys.